I'm going to do now is hand over to Jane to introduce Jim.
Hello, Jim. Welcome.
Hi,
Welcome to our meeting this afternoon. I'm delighted that you can be with us. Jim is a public representative who has a long track record of working with researchers. I'm not going to say any more than that. I'm going to hand over to Jim. Jim, I'm sure that you can much better introduce yourself than I can. So over to you. Thank you for joining us this afternoon.
Okay, thank you, Jane, and hello everybody. It's a real pleasure to be able to join you today, and just really enjoyed those presentations we just seen. Really illustrates a wonderful range of research. Very exciting. I'm going to share some slides and just talk through a little bit about kind of what I do, getting involved in research, why that is, and a few sort of, I guess, sort of hints and tips from my perspective that I hope will be useful to you. So let me go, let's see, here we go. So is that all clear for everyone? Has that come through? So I'll just go straight on to a bit of background really. So I live in Pembrokeshire, where I've lived for about 8 years now. Why I've got involved in research is because of cancer, which has been a kind of constant part of my life for about the last 25 years. Starting with my first wife, who had and then died of an aggressive form of breast cancer, and then it's just gone on and on and on ever since. And my eldest of 5 brothers has a non-aggressive form of prostate cancer, which he's living with quite successfully. And our sister's been unlucky enough to have been diagnosed 3 times through the national screening campaigns program. So twice with breast cancer and once with bowel cancer. So I'm a great fan of screening programs because she's been diagnosed early each time, and that's really shown the benefits of that. And she's taken part in a study. So that, which is a very common theme for people who get involved in research, has kind of made me want to give something back. So I've, for quite a long time now, 10 or more years, I've been using some of my time to try to help out a bit in ways that I can. So I've got a number of roles. And the sort of relevant ones here for cancer is just one of the research partners for the Wales Cancer Research Centre, and I'll talk a little bit more about what we are as research partners and what we do. I'm also with the National Cancer Research Institute in the both their overall advisory group, but also with the Living With and Beyond Cancer Executive Group and Methodology Workstream. Been involved with Cancer Research UK for quite a long time, and I'm part of the Cancer Grand Challenges advocacy panel, which is fascinating and really interesting. And I'm a member of a little charity called Independent Cancer Patients Voice. And those things give me kind of access to lots of other people like me, either patients themselves or like me as a carer, so that we can share ideas and help each other out. And then kind of my day job 3 days a week is I work as the public involvement lead for the Health Research Authority. And I mention that because it'll bring some of the things in there, but actually it's one of the things that's interesting about public involvement. What I like is that, as well as bringing our lived experiences of what's happened to us in this particular case, cancer, we also bring our other life experiences. And when you get a group of patient advocates or people get involved in a room, you never know what else they're going to throw into the mix, which is, I find, really quite exciting. So the research partners at the Wales Cancer Research Centre, this is, you may be familiar with the sort of different parts of the Wales Cancer Research Centre, but I'm not going to go into this in detail. But it's just to show that across both at all the levels of governance, there are at the moment 7 of us as research partners, and our role there is really about trying to support and enable patients, carers, and other people to get involved in the research across the whole centre. And each of the main areas has 1 or 2 research partners are sort of assigned to it, although we work across, and work with each other and do other things. So part of our role is, if there's something of interest to us directly, we can get involved in individual studies, and when we do that, and my other fellow research partners probably a bit more than me so far, but also our role is a kind of facilitative one, so is to and an advisory one, so to help people, any of the researchers in any of the areas across the Wales Cancer Research Centre to work out what sort of involvement might be appropriate for their projects, how they might find those people if they're not going to be us, and to sort of facilitate bringing on board lots of other people. And that would also extend to the rapid response panel, which Jane mentioned at the beginning. So very much a kind of facilitative role overall. I think you're probably aware, most people are probably aware of something about patient public involvement. And I used this cartoon for a number of years because I think some people think it's all about kind of muscling in and, you know, getting your sharp elbows in the way and interfering. And it's not at all, of course. And public involvement or patient public involvement, lots of different names for it. Consumer involvement's used in the National Cancer Research Institute. In services, they talk about patient engagement. There's lots of different terms, but and you probably already know this, but this is about research being carried out with and by patients, carers, service users, members of the public, rather than doing research to them or doing research about or for them. And that kind of covers it in a way, but I tend to think of this in a phrase and approach I prefer is thinking about this as working in partnership with the people in the communities the research is intended to benefit. And thinking about Sophie's presentation about, you know, research and prescribing with colleagues, actually that can be staff as well, because that's a, you know, benefits to staff. So it isn't entirely about research that always affects patients and members of the public. And I say there are lots of different terms about this. I have a personal bugbear about using the payment protection insurance abbreviation and really prefer not to use it, but if you have to, just use it in your own notes. But it does lead to a lot of confusion, and I think it takes away from this being about working in partnership. And one of the things, you're probably aware of the old Donald Rumsfeld, unknown unknowns, known knowns, and known unknowns. One of the things that getting people who can bring their lived experience to clinical research is it does help you kind of learn about some of the unknown unknowns. So those of you who work with patients will know a lot about your patients in general and specifically, and you'll probably know the things you don't know about them, but you probably won't know the things you won't know the things you don't know. And actually bringing us into the room and being part of that is a way of helping to sort of unearth the unknown unknowns. And you may have heard of the UK standards for public involvement, which are a kind of overarching aspirational set of standards. And I would strongly recommend, if you haven't looked at those, that you look at those. You don't have to meet them all, and you don't have to achieve everything in them, but they're there to kind of help the way things go along. So one of the things about, you know, because we bring more than just our lived experience of cancer in this case to research, we bring our other skills and experiences in life. One of the things that, you know, we do is help spot the elephant in the room, and think of things, and actually quite often are bold enough to say things that other people won't say. And all too often people say, actually, I'm really glad you said that. I wouldn't have said that myself. So that is one of the added benefits to us getting involved. There's lots and lots and lots of advice out here, so I'm going to just pick up on a few bits and pieces that I think are helpful. But the Health Research Authority, who I work with, we've developed some best practice principles, which are principally focused around clinical research, and some of it's very slightly different in non-clinical research, but we're mainly talking about clinical research today. And they're really sort of 4 very simple principles. One's around involving the right people, which you put right in inverted commas. So that's about working out who, you know, which people and communities are benefiting from the research or are going to benefit from the research, and what sort of experiences would be most useful to the research. And actually your research question can often tell you that. Involve enough people, so it's not just one person giving you one bit of advice at one point. Think about getting a breadth and depth of input, so more than just one person, because you might involve somebody who's really helpful, but actually their views might be quite skewed and take you away from perhaps some of the other issues you might have missed. Involve those people enough, so trying to not just do a one-off quick question to somebody, what do you think of this, but actually thinking about involving people early, from as early as you possibly can, all the way through, if you possibly can, to get as many different contributions. And then actually describing how it helps, whether that's in an application for research funding, or in the case of the Health Research Authority, in an application for Research Ethics Committee approval. You know, say how the involvement of people has helped make the study ethical, which means about it being important to the people it's going to benefit, relevant to their lives and their care and support and treatment, and acceptable to take part in. And that's a really key part of it. There's a couple of really useful papers which you might like to read one evening. One about just thinking, and this goes back to the unknown unknowns, is thinking about public involvement when working in partnership with people and communities as a learning process. So it's not an intervention, so you don't do it to people. It's about a way of working. It's about working in partnership. And Christina Staley and Duncan Barron's paper is really good in terms of thinking about what it is we learn, and it picks up on the unknown unknowns aspect of it. And then the other is about, who should be involved. It isn't always necessarily the people you think it might be, and is specific lived experience of a particular condition vital in a particular circumstances or not, or should you have a blend of those? And the paper that Christina led, that I was part of, just goes into some of that as well. And then just really to finish off, a few sort of thoughts around, for those of you who haven't involved patients in the public, patients carers in your research before, I mean, I enthuse about it and encourage you to give it a go, because it will help. I'm absolutely convinced of that. But there's some really obvious things that you can do. So, there are colleagues you'll find who have worked with patients in the public. So go to them, ask them about it, ask for some advice and help. Ask to observe some, people working with patients, see what it's like. It's not scary. With the Wales Cancer Research Centre Research Partnership partners and the Rapid Response Panel, you can come to us, and for nursing and allied health professions, I'm the kind of designated lead for that. So I'm very, very happy to talk to any of you, and we can make my email address available to you. And then there's an absolute wealth of guidance available, and I wouldn't want to put too much, but 3 quite nice introductory ones is Health and Care Research Wales have done a nice sort of online course. It's a sort of interactive set of PowerPoint presentations, which just leads you through this, which was updated in April of this year. And that's really good. It doesn't take all that long to go through, but it just covers the basics. National Institute for Health Research has quite a nice just single web page, which just covers lots of really simple basics and goes through all the different aspects of the things to think about, with lots of links to other things. And then also the briefing notes for researchers, which was produced by Involve, as was, and now the National Institute for Health Research Centre for Engagement and Dissemination, has a sort of briefing notes for researchers, and there are reciprocal ones for those of us who get involved as well. So that is kind of what I wanted to say in terms of sort of broad background. Happy to take any questions, but I'm aware that I've introduced a delay with my crashing internet.
Thank you, Jim. That was excellent. May we have a copy of your slides,
Of course,
so
yeah,
that we
yeah.
have those links to the documents and the resources?
Yeah, definitely.
Thank you.
Definitely.
Thank you. That'd be great. Please kind of put your hand up if you'd like to ask Jim a question. I'm going to kick off. Jim, I'm seeking a top tip. So for a member of the public who is going to be working with clinicians and researchers, what for you makes it easier? What's your top tip for making it easy for a research partner?
The personal approach, really. Making contact, having a conversation early on, and yeah, being made to feel welcome. It's all about the relationship. That's what research is about. So yeah, a direct contact early, and a quick conversation. And I had one of those yesterday with one of the leads in one of the programs I hadn't spoken to before, and that was just made me feel like I was wanted in a sense. And it's it's not as it's just helps as you move forward. And don't be afraid to pick the phone up or send an email. Those who want to get involved really want to get involved because we want to help, and we'll respond.
Thank you. That's helpful to hear, actually, in that it can be quite scary I suggest on a researcher side as well, thinking, well, it's about the unknown, isn't it? It's about contacting somebody that you don't know. And it's just so important to reach out and have the conversation, whether it be by phone, by Zoom, or in different times, face to face.
Yeah, absolutely so.
Okay, we've got some things coming into the chat here. We have Mandy Edwards saying, thanks, Jim. Always good to have a clear, patient voice. Stops us falling into using acronyms and unintelligible jargon. Kath Mathams is saying, thank you, Jim. Really enjoyed listening to you. Sarah Pocknell is saying, thanks, Jim. Very informative. Has anybody got a question that they'd like to ask? No, okay. What we'll do after the meeting is share Jim's slides and email address. So should you have a project idea and wish to talk with Jim about it, then you'll have his contact email